Hi, everyone. I'm Dr. Pam Schaff, and I am the director of Keck School of Medicine HEAL program. So the exhibit that we are looking at today, the Imperfect Body exhibit, continues our school's mission, the HEAL program's mission, to align the work of artist patients with our core curriculum and to foster enhanced understanding between patients and future healthcare professionals. So we're very glad to have you here today, and I'm especially pleased to welcome our artist today. Elizabeth Jameson is an artist who specializes in the intersection of art and science. Her work creates interest and curiosity about the imperfect body and serves as an invitation to open up conversations about what it means to have an illness or disability as part of the universal human experience. She is not only an artist, she is a writer and a former public interest lawyer. She's written about illness and disability in publications such as the New York Times, the British Medical Journal, and Wired magazine. Her work is part of permanent collections at the National Institutes of Health, major universities and medical schools throughout the nation. And in 2016, she delivered a TEDx talk called Learning to Celebrate and Embrace Our Imperfect Bodies. I'm also pleased to welcome Dr. Lilyana Amezcua, who I know from our work together in curriculum. Dr. Amezcua is Associate Professor of Neurology and also the Fellowship Director for the Multiple Sclerosis Fellowship Program. And last but not least, it is my pleasure to introduce Ted Meyer, who is our artist in residence, and he is going to take it from here and facilitate a conversation, and then we'll open it up for a question and answer.
Hi, thanks everybody for coming. Before we go to the back and forth, Elizabeth sort of wanted to make a statement at the beginning.
I'm so delighted to be here, and thank you for allowing me to talk to all of you as medical students. And because disability is a Lyme company, very common worldwide, I really would love to encourage you to deal with chronic illness and disability as a way of being human. And that means you need to be supported as practitioners, because if you're not supported, you won't survive. Practice of chronic illness is hard, and I would like to do whatever I could to open up communication between providers and patients. And I think that's critical so that I can be more empathetic to you as a practitioner, and you can be more empathetic to me as a patient. But it's a two-way street, and I just so want to honor you and encourage you to be able to embrace those of us who have severe chronic illnesses, because we're human. You're painfully human. We're all in it together, whether we're patients or providers. So thank you very much. I'm so delighted to talk to you.
All right. So you were in law school in your 20s. You started having some symptoms, but you weren't diagnosed till your 40s, right? And you had little trouble walking, and symptoms were starting to show up. So with that in mind, how did you start when did you first find that you had to start making major adjustments to your life because of your symptoms? And what was that like as far as work, and you have children, and all of a sudden you're having to readjust because of your illness?
Well, I went to law school when I graduated from my undergraduate school. I knew I wanted to be a human rights lawyer, so social justice is always what I want to do. So I worked in jails and prisons and solitary confinement, and I went all over the country involving juveniles and jails, prisons, and trying to really throw some sunlight or openness in terms of the tragedy of so many kids being incarcerated throughout the country. And then I went into healthcare and worked on HMOs and the abuses that I found in terms of HMOs not covering various medically necessary issues that, like wheelchairs and tracheotomy, and nursing care, etc. So I've been litigating, as well as a lot of other people involving healthcare. And then I fast forward. After I've been practicing for 10 years, I was at the park with my two kids. I'm sorry about my voice. That's my latest thing about MS. I'm struggling to keep my voice. My diaphragm is failing me. I was at the park, and I totally lost my voice. I was totally aphasic. And then I had brain surgery because I didn't know whether it was some huge lesion involving cancer. And I couldn't figure out why I had this huge lesion. And one of these paintings are of this lesion. And I couldn't talk. Took me a while to regain any speech, and I couldn't practice law anymore. I didn't feel comfortable with my voice and word finding skills, and I had to do something, and I still wanted to do social justice. And I somehow bumped into art, never done art before, and all of a sudden I went, oh my God, I was hit by lightning. The smell of paint just was a zap to my brain. And my first class and this neighborhood art school, I said, that's what I'm gonna do. But I wanted to make sure it was political and had to do with making the world a better place. I wasn't interested in anything that wouldn't be helpful to other people. So I wanted to be a public interest artist, coming from a public interest, a lawyer. Then I turned into an artist. And I discovered, I went to art school, and then I did beautiful paintings of flowers. I got really bored. I thought, this is not what I want to do. Even though I love paintings of beautiful flowers, I love them. But I thought, no, I want to do something that would help people. And because that's in my soul, that I want to be an activist in terms of helping people with whatever brain power I had. I want to do that. And I discovered what could I do. And I discovered the MRI. I had stacks of MRIs. That was before I'm an old lady, so at that time, it was just digital images, but not on, you couldn't go to a radiologist and I want the images. And so I really worked with my neurologist and the neuroimaging people and said, give me images of MRIs, and I'd like my MRIs. And I went to my office. I said, all right, that's what I'm going to do. And that's what I did. All this is because, and I feel for me, it's a universal symbol of MS, is the MRI, that almost everyone in first world countries get access to MRIs now. That's generally how people tend to be diagnosed in order to rule out other diseases. So it's and so I thought that's what I can do, because it was terrifying. MRIs are very scary. They're black and white digital images, and who wants to stare MRI, and who wants to stare at your lesions? I mean, my lesion was huge in the Broca's Center. That's why I lost my voice. And I thought, this is really scary. And so I want to take ownership of that MRI and be friends with my MRI and make it beautiful, interesting, complex, and not stick a smile face on MRIs, but to say, this is damn interesting. So why don't we do more and more? And so this is years of worth of progression of my disease. When I started, I wasn't in a wheelchair. I wasn't walking badly at all. My symptom was I couldn't talk very well. My word finding was horrible. But that was year after year after year of cane to walker to scooter to wheelchair to being a quadriplegic, so with lots of types of wheelchairs and walking assistants. So that's my journey. What's around the world.
We're going to switch to the doctor for a second.
Please.
So what is it about this specialty, first of all, that brought you to this? You could have, are we on? Yeah. You could have done a lot of different specialties. You chose neurology, this in particular. So how did you know this was the right one? Was there a certain event or something where you sort of made this decision?
Well, there was, and it's always very touching to hear the different stories. And for me personally, my journey was to become a neurologist with the goal of, my goal of medical school was neurology for a very personal reason. I was touched by my brother having a chronic disease, neurological, very young. And so I always, it's been a personal journey as well. And it wasn't MS that I started learning about MS until I was a resident here at USC. And one of my greatest mentors was Leslie Weiner, who is an MS specialist and one of the greatest. One night I was in the LA County Hospital and I was called to see a young male in his early 30s, and he was working at Home Depot, and he felt that he wasn't using his leg correctly, and he attributed to some low back pain. And it was there that I was giving my first diagnosis of MS, and all it took was me to see him and see the reflection of my brother. And so it's been, sort of a personal journey, and so I ended up picking MS as my specialty, and I've been practicing taking care of MS for now a little over 10 years. I can't believe that's been that long. So that's how I ended up in medicine, and that's how I end up where I am today, and I would not change it.
So how do you put a team together, a good care team, and then to Elizabeth, how do you put a team together of people to help care for you and make sure your life continues on and that you can do your art and all these other wonderful things you're doing?
I think the key thing that you just mentioned is a team. It is not just me alone taking care of Elizabeth or someone with MS. It requires many others to help us. MS, it is a central nervous system disease, right, affecting the brain and spinal cord and optic nerve. We need neurology, but we also need to just be open and listen to what the patients are experiencing. And some of the times, many of their symptoms may not make sense. And so we have to listen. We have to be able to realize that we don't know everything as well. And that it may require other specialists to help us, not necessarily other MDs. We certainly, putting, like the team at USC involves, social workers, counselors, bladder specialists, physical therapists, occupational therapists, to really provide that multidisciplinary team care that the patient needs. But above all, we also need to be accessible in respect to, again, listening to them, be able to grow with them. One of the things that I do enjoy is that there's a continuity to me seeing them over the years. Of course, my goal is to keep them stable and not progressing. The field has progressed tremendously. I mean, I remember when I first started in this field, the diagnosis of MS took longer. Now, the fact that we are reporting that there are almost 1 million patients in the US affected with MS has to do also with being able to provide an earlier diagnosis. And so we need to be able to, if you are out there as a medical student and not going to be a neurologist, and are in internal medicine, family medicine, and you get someone in their young 20s or 30s having some sort of a neurological complaint, don't ignore it, pay attention to it, because this could be MS, and early diagnosis is really important, where we can see perhaps that we can make a greater difference. So that's what I would say, in terms of team continuity that I like, and also be cognizant that with MS, you also have, as you're seeing them over time, you're also seeing them get older. And so it's important to not also attribute everything to MS as a neurologist, and also explore other things that may come up that are just part of, I wouldn't say normal aging, but other conditions that become more prevalent at an older age. So there has to be also communication with the primary care.
So Elizabeth, when you talk about this, I'd like you to talk about putting your team together, because for you, I mean, these people are in your house. You sort of have lost a lot of privacy. That's part of having MS. And then if you could talk a little bit about how you're doing your art now, because I'm assuming there's teamwork involved in doing your art since you've lost the use of your arms. So how are you creative with another person? How does that teamwork work?
Well, It's such a huge question. My needs keep changing as my disease progresses. I'm losing all autonomy with my body, but so I have wonderful assistants like Lisa, and it depends what I'm doing. I've done artwork involving embroidery recently, and I had a wonderful assistant, Lisa, help me do some embroidery of my brain and my DTIs, which are diffusion tensor imaging, which I'm fascinated with. And if I had hands, I would spend probably a third of my career on DTIs. And but now I'm writing. Now I'm really passionate about writing. So my needs keep changing. Now I can't operate the computer. So I use facial recognition and voice recognition. And it's very, it's challenging, but the more disabled I become, the more I'm fascinated by what I can do that could maybe enlighten or help not be, people would be, I don't want people to be afraid of us or disabled. We're fascinating. I think that disease of MS is really interesting. And I think being a quadriplegic is really interesting because I was a totally normal person, very athletic. I was a courtroom lawyer, and now I can't do anything. I can't brush my teeth or blow my nose. And I feel like, wow, it's great topics for writing with humor about this wild and crazy position I'm in. And I don't feel that being a quadist makes me needing sympathy. It's just something I have to deal with. And it's a wild ride and fascinating. And I'm ready for the next hurdle, except lack of my voice, and I'll be really cranky and not very nice and won't smile as widely as I am now. But
How is it to do art with someone else? Because I don't
Very
know.
hard.
Or maybe you can explain how you took your black and white MRIs that were so scary and isolating looking, and you add all this color, and I don't actually know the process, whether you're telling someone else to add the color, but you're choosing how are you making these images?
it depends on my stage of my disease. When I first started doing these etchings, I had MS. I was becoming increasingly disabled, but I used my hands, so I did all myself. And these are etchings, so I went to the printing studio and chose the most exquisite French printing inks, and etched them on copper. So that I took the brain, various sections of the brain, and burned them in the sun, and then took the plates into the printing studio and inked the plates. That's the art of printmaking. So that's pretty physical work. The labor of etching the ink on the plate, and I can't do that anymore. So, but I did have lots of help by Lisa and my various art assistants. I work with an art assistant. I mean, everything from the second my art assistant arrives. Lisa comes and we sit practically in each other's laps, and we have to make sure we don't have bad breath. We have to make sure that we have good coffee, a little chocolate, and then we go. So everything is I don't do anything without the help of Lisa or other people or Lonnie. So in case I sneeze, so.
So part of what you do is there's such a psychological component to because when you give someone a diagnosis, their immediate thought is this could be my outcome. So how you're trained as a medical specialist, but then there's this whole other aspect that you have to deal with patients. So is that something you deal with, or do you hand that off to someone in your team to be the psychological, or how do you get people through the initial shock of you've got this long slog ahead of you?
So, we all do a little bit of psychology, and certainly when we are about to give a diagnosis, it's going to be a longer visit than expected. Being in academia, it gives you the ability to spend a lot more time with patients. And certainly when you are out in the private world, it can be a lot more difficult because you don't have the time. I can tell you, giving a new diagnosis every time, it's hard. Some individuals that see us have already gotten some idea that perhaps they have MS, and that probably has to do with us being a tertiary care center. So they've seen several ones to finally get to us, and maybe we're finally confirming the diagnosis. And some of them, sometimes the reaction is a relief because now they have a name to what they've been experiencing for years. And others, it is a shock. They were not expecting that. And so we have to be ready to deal with those reactions. And others, there may be some family support next to them. They came to the appointment with several other individuals, and that can be quite helpful because a lot of what we're going to say that day is not going to go in. And we understand that. So many times as we're giving the diagnosis, we're also trying to provide hope, and go over what we have at that time, because obviously MS has been changing. And so right now we have a lot more to offer than what we had before and probably at the time that Elizabeth was diagnosed. It's also, you're giving a diagnosis not just to the patient, but to the family. And so we can have a lot of different reactions, and the next visit, sometimes we do try to make a quicker visit right after to provide a little bit more education, depending again on the situation, or we may need Kara's in the audience. We might need Kara support, who's our fabulous counselor and social worker, to help the individual cope with this new diagnosis. But I can tell you, it's not fast. It can be 6 months. It can be a year. It can be 2 years for someone to accept or not accept at all. And so, and that, goes along with the fact that MS is scary, right? There is, and MS is complex. It's complex for the neurologist outside. It's complex to the patient. It's complex because it involves a system that we don't talk much about. The immune system. What is the immune system? I mean, apart from the fact that it's affecting the brain, but just in itself, knowing what the immune system, it's a little difficult to understand and how we need to treat it. So yes, always giving a new diagnosis. We take in what was mentioned during the visit, see where they are in the face of what they were expecting that day. Did they come prepared or were they not prepared? And we try to adjust with that the best that we can. But we still have a lot of work to do. And it has to do with us as physicians and you as medical students eventually understanding how the social aspects, which we call social determinants of health, right? That we need to pay attention to this as well.
Okay, so the next question's for Elizabeth, but while she's answering, you can look at the art, because next you have to talk about her art for a second. So my brother had Parkinson's, and I know with him there was sort of always this line of, when I get to that point, I don't think life will be worth living. And then he'd get to that point and he'd go, well, there's the next point. So I assume that I don't know, because you seem so happy, and I'm always, when we've talked, we'd only met one other time up at Stanford, but I was like, oh my God, she's just seems so joyous, and you're going through all this. So did you have points where you went, I don't want to get past that point? And how do you keep doing work? How do you keep motivated to write for the New York Times, to do art, to do all these different things? Because I think it's important for all these med students to see that even at the point you're at, your life is worth living for you, and that they're going to have patients. And, I found when I deal with other patients from my other work that sometimes the med students, or just doctors in general, they see things over and over again, and they sort of know an outcome, and they don't think of the life that's still livable by the patients. And you're living an amazing life. You're traveling, you're writing. So have you had those points of going?
Absolutely. One thing, I just wrote a blog about living life with progressive MS, and it's a shit show. And I'm sorry to swear, but I think that if you take that philosophy, then you go on, but denying you're in a difficult situation doesn't work for most people. I believe it doesn't work for me. And then you go for what I've been able to do is go forward, because I get bored with myself. Then I decide, what can I create? What can I do with the idea of helping other people, helping myself, helping the medical community? So, but it is a day at a time, because the ups and downs. I know I seem joyous, but this is today. You couldn't see me on Monday, forget it. It just, ask my husband, I'm not a perfect person to live with, for sure. And I wish I could say I'm joyous all the time. I'm not. I'm a human being, just like you as medical students are human beings. You're going to make mistakes, you're going to fail. And I'm just think we need to support you as medical students, is to do the best you can and to see us as human beings. When I saw someone like me in the waiting room, I would not sit next to people in wheelchairs. They were absolutely terrifying to me, because I didn't want to be like them, and I wasn't going to be like them. And now I am like them, now probably worse. And I notice some people get up and move because they don't want to be near me. It's when I'm now that I have to be fed, there's some people who move way far away from me because I'm scary. It's amazing to feel that I'm scary now. But, we're all human. And thank God we're human. Thank God I'm quadriplegic, because the opposite would be death. And I'm alive and kicking. And so I just would like to encourage you as medical students to embrace what you're doing and know how hard it is, and how much joy hopefully you can get in your profession. but it has to be with communication with the patients. And patients need to communicate with you as providers. I think that is so critical, not to have silos. So you don't really get to know the patients. Patients don't get to know you. And I'm so delighted to be able to talk to you about ways we could work together to open up the silos. Because I want you to be doing chronic illness work in 20 years and not go home and get depressed and you want to go do plastic surgery instead of dealing with the messiness of MS. Mess is really down and dirty. I mean, there's really no treatment. There's there's some things you can do. My level of disease, I haven't seen my doctor in 3 years because there's nothing he can do for me. And he said to me, I can see you once a year, but if you have better things to do, why don't you do that instead of seeing me? Because I ain't gonna do anything for you. But and he said very lovingly, not dismissively. He just said, "You're really busy, so skip the appointment." And I really appreciated his frankness. And I just want you as young students to be honored for the hard work as a neurologist or whatever specialty you end up doing. And I'm looking to work with you to find ways that we can all talk to each other. And hopefully art is a one way we can find some common grounds.
So that puts it over to you. So looking at her work and how she's used these images to show the progression of her illness over the years, what are your thoughts?
Well, when I see your art, and I've gotten the pleasure of seeing some of your art before today, and Dr. Pelletier is here. So when I first saw her, which is these pieces over here, which I believe are some of your very first pieces. Is that correct?
Yeah.
And when I saw this, I felt actually like a powerful, good feeling and felt like this almost was a sun in the background. I wasn't thinking about what it is that you describe, which is, they're ugly. The MRIs are ugly. They're black and white, maybe some shades of gray,
Right.
and they're dark. And as a physician, you don't think much about it, right? You put it up all the time. But I can think really as a patient how that could be really scary and not wanting to see your brain. But when I see this, it's beautiful. It's beautiful. It tells us that there's resilience behind this individual, and that's what I'm seeing. I'm seeing great resilience, great, sort of taking over what MS has done, and you being above MS. Those pieces over there I've never seen these before. I would love to take more time to just go over them. And but here in this one, because I know it's the lower part of your spine and getting some aspects of your hip, I'm thinking bladder dysfunction and multiple sclerosis, which can be affected. It's dark. This one is dark. And what was your thoughts behind that day? We know MS has ups and downs, right? But you're right to say that being human, you have ups and downs. And so the ups and downs with chronic disease are very visible. And I know there's some over there that are just magnificent. I love that silk one hanging, and I would love to hear more behind the production of each one of them. But again, now that I've met Elizabeth and hearing her stories from before and just seeing these pieces, I feel that this provides, and maybe, I don't know what other individuals that are affected with MS feel, but I feel, there's resilience, there's hope, there's something beyond MS. The piece that you shared with me that you wrote about closeness was lovely. And I don't know if you heard about, it's up in the wall, yes. And so I don't know if you want to say something about it, but it's a piece in the New York Times, I believe, that talks about, that closeness can be in different ways. And her closeness between your other friend with breast cancer, if I remember, just in different ways, how can we be close? And that, it also told me that it's, again, there is MS, but there's a human being. And how do we as us, maybe it's in the lobby, that not to be scared to sit next to somebody with a wheelchair, right? And to be able to speak to those that you are seeing that are, maybe have less capacity to do so, but still be able to be, provide some closeness in different ways as before. And
Should we open it up for questions, or do you want to respond to anything she said?
One thing is, I don't feel my images are above my disease. I think my disease is on my shoulder, and I want to love what's on my shoulder. It's like a bird on the shoulder. It's always going to be there. And some days it's biting me. Sometimes it's drawing blood. Sometimes it's cooing. It's just, I have a moral obligation to like the bird, and I don't to like the bird, but be respectful of the bird, because it's always there. It's me, and I want to love me. So I have to say, look, I have a bad disease, but it's part of me. It's on my shoulder, and make friends with it and love it and move on.
Are there any questions for the doctor or our lovely artist here?
Yes, it's a very impressive presentation. It's great to be here. I want to ask you, the writing and the speaking aside, specifically your artwork, what do you get from the gestation period of thinking about what it is you want to make, and then it coming to fruition and seeing it when it's done? How does that affect you, and how does it help you relate to either your particular disease that you've become so intimate with?
Oh, it's a complex question. When I see neurotechnology, I always look for the newest technology or use the older technology in a different way, just trying to find interest and beauty and ugliness, all the images that would convey the complexity of chronic illness. It's all complexity. And I love neuroimaging because you make what's invisible visible. The brain is totally invisible. And with an MRI, it's visible. Again, because it's my brain, I want to be beautiful and ugly and everything else that being human is. So that's what I do with the images, trying to make it so that it celebrates the complexity of being human.
Okay, we have another question over here.
Hi, thank you so much.
Thank you.
This is really a question for Lisa and caretaker and also the clinician. How does working with an artist enhance or change your experience with them? How does it help you in the process of developing a relationship or in the process of caring for them?
Here.
Well, today I am meeting Elizabeth for the first time, and but like I mentioned before, I had seen some of her beautiful art before, so I was familiar with it. And for me, just being a clinician, there is art to it as well. And so I feel a closeness in a different way where, it almost, sort of reminds me to, this humbleness. Again, the way that she's saying the disease is like a bird on her shoulder, that, and that to me is so powerful and important. And so that in itself, her words are artistic as well, but they have so much more meaning to me as a clinician. And so it's just a reminder that, we are dealing with human beings and not, we call them patients, right? But every time we go in that room, it's a human being with a new story, a different story. Everyone is unique. Everybody carries their burden a different way. And so in a way, today, it gives me another different and amazing story for me to take and take it back to see how I can actually be a better clinician going forward.
Okay, so to answer your question, it is an absolute privilege to love this beautiful soul. She has an amazing heart to share her gifts with the world and to see that this body and how it is, that it doesn't stop her from loving and giving her very best to everybody in the midst of being fed and bathroom at its highest, lowest part of your life, that you could still find the joy and the beauty in it. So I think for me and any of the caregivers, if you have an opportunity to be with another human being, to serve them at their highest capability of love, you have blessed the world tremendously.
This is all artwork and imageries that if this was a typically normal, healthy person, this would have never been created. And all this beauty, any of these pieces would look lovely in your house, I'm sure. This all came out of illness. These are images that would not have happened had this person not been wanting to talk to you and me and everyone around them about their illness. And that's what we do in the gallery here. And Dr. Schaff has the HEAL program, and she does writing and reading and all these things to help you guys sort of get into the mind and the humanity of your future patients.
Thank you, Ted. Thank you, Elizabeth. Thank you, Lilyana. Thank you, Katie. I just, every time we do this, I think it can't get any better. And this was just incredible. I don't really have words. I was just in tears a few minutes ago. So I'm just going to say thank you for sharing your story, yourself, your beautiful art, and all of you for being part of this conversation, which I think can only make us better at whatever we do. So thank you so much.